Dear learners, welcome back to NPTEL online certification course on novel drug delivery systems. I am Dr. Satish Devanapelli, Assistant Professor at Department of Pharmaceutical Sciences and Technology, Institute of Chemical Technology, Mumbai. In our novel drug delivery systems, we are discussing on the transdermal drug delivery systems. In our previous lecture, we have discussed on the what are the transdermal drug delivery systems, and also we have discussed the various drugs which used for the treatment of the diseases, and also we have discussed on the advantages, limitations of the transdermal drug delivery systems, and further we have discussed on the ideal characteristics of transdermal drug delivery systems. Then we have discussed the anatomy of the human skin, and then we studied the what are the barriers which will affect the permeation of the drug across the skin. And then we have seen the skin absorption pathways and the barriers of the skin. So, today we are going to discuss on the factors affecting transdermal permeation. So, here we can classify this into the three categories, that is the physicochemical properties of drug molecules, that is the first one, and the second one is physicochemical properties of drug delivery systems, nothing but dosage forms, and the third one is the biological factors, or you can say the physiology or pathophysiology of the pathological conditions of the skin. So, these three factors are majorly important for the transdermal permeation. The drug molecule as well as drug delivery systems and the biological factors will influence the overall permeation of the drug through the skin. So, again here we can see the classification, this is a one, and the second factor and the third factor. So, further in the drug molecule, so these are the properties like partition coefficient and the pH and then drug concentration as an important parameters or factors which will influence the overall transdermal permeation. And then we are going to discuss on the physicochemical properties of the drug delivery system, which are related to the dosage form, the release of the drug from the delivery system, and the composition which we are going to use in the drug delivery system, and also there are the specialized ingredients or specialized excipients which are called as permeation enhancers, which will help further permeate the drug. That is also we will see, that is also another factor. And in the third one is biological factors. We are going to discuss on the effect of the various layers of the skin on the transdermal permeation and their conditions like moisture, skin hydration, skin temperature also will affect the permeation of the drugs across the skin. So, as we know, in the pre-formulation we will study about the various physicochemical properties of the drug to design right formulation which will work on at right place and the drug will release at right time. So, that is the purpose of studying the pre-formulation, and after doing the pre-formulation we will understand what is the nature of the drug. That means, we will know the physical properties of the drug as well as chemical properties of the drug, that is molecular weight and their solubility and the pKa, and then we will also study the crystallinity, amorphous form, and then also we will see some of the log P values, that is a partition coefficient, and we will do all type of pre-formulation studies including stability studies. Then we will understand the nature of the drug. According to that, to overcome all type of the limitations of the drugs, will develop required formulation which will show the effect for the particular disease. To ultimate, to improve the performance of your drug, we convert into the formulations. So, in that, so one parameter physicochemical properties, that is the partition coefficient, is very important for the drugs which are going to use for the transdermal delivery. So, because that is very crucial for the permeation. So, we know that the partition coefficient. So, here we try to measure the amount of the drug in the oil phase as well as aqueous phase. Known experiment is that the octanol water test we perform, and we will see the amount of the drug present in the lipophilic medium and as well as aqueous medium. So, with that, what we understand that is very important for the permeability. So, here the proportion of the drug in the lipid and the water should be greater than 1 when you want to go for the as in a transdermal drug delivery systems. So, these parameters are very important. So, with that will help to move the molecule from the formulation to the skin. So, partition coefficient is very important while designing the physicochemical properties. Your partition coefficient should be more than 1 for the transdermal patches. So, the second parameter is the fate of the drug at the pH of the skin. So, now we know that the permeation, for the permeation of the drug, your drug need to be in the anionized form. So, that is affected by the pH, whether it may be oral or any other formulation. So, the pH of that the delivery site is very important. So, that will ultimately influence the ionization of the drug. So, the penetration of ionized drugs can be affected by the pH of the skin. So, ionized form at that particular pH is very important, and ultimately the pH of the skin and the drug formulation both will affect the solubility as well as permeability of the formulation. So, this need to be considered. Then optimal pH, that is 4.1 to 5.1, the optimal pH 4.1 to 5.8 beneficial for the better drug permeation. So, solution with either high and the low pH might cause the skin irritation. So, to maintain this, we need to convert our formulation in the range of 4.1 to 5.8. So, the overall the pH of your formulation, whether it any type of dosage form, that need to be converted to the 4.1 to 5.8. So, which will avoid all type of irritations and damage in the skin. The third point in the physicochemical properties of the drug molecules, drug concentration at the site of administration. So, here as we know that we studied in the permeation mechanism. So, here these will follow the passive diffusion process. So, the concentration at the site of administration is very important. It depends on the how much drug is present at the skin surface. Now, high concentration at the site of absorption, that it will give the high bioavailability. The larger surface area of application increases, the amount of the drug is absorbed. So, we need to deliver the maximum drug concentration, but that is one of the major limitation in the loading of the all type of the patches. So, and the drug must be in the suitable carrier to stay contact with the skin at the right concentration. So, you after administration, so immediately your drug need to be released out and come out from that formulation, that need to be contact for the longer time by using of some mucoadhesive or various types of the retention enhancement strategies will help for the high drug concentration at the site of the administration. And coming to the second factor, that is drug delivery systems. Here the drug release characteristics are very important. So, here we try to see the release of the drug from the formulation. The faster the drug is released from the delivery system, the higher the skin permeation. So, as we discussed in previous point, this is related to the previous point which we discussed on the drug concentration at the site of administration. So, once your drug is released very fastly, so it is available for the absorption and then permeation. So, drug molecule should have stronger attraction to the skin than the delivery of the vehicle. There are the drugs which will interact with the components we use in our formulation to show the control release. For example, polymers, and we use permeation enhancers, we use some other adhesives. So, that excipient, that materials, that inactive pharmaceutical ingredients should not attract the drug molecules. So, if that have high affinity, so it will not help for the fulfilling the purpose of the drug delivery systems. So, the immediately, or you can say the slowly, the drug need to be passed away from the carrier, and then it slowly it should be released at the site of administration. And yes, the interfacial partition coefficient, that is drugs tendency to move from vehicle to skin, play major role, and that comes particularly with the drug properties as well as components which we are using in the preparation of the drug delivery system. So, we need to develop such a system, so that should pass the molecule to the skin. And the second one, in the physicochemical properties of drug delivery system, the composition of the drug delivery systems. So, as we discussed, the component need to be incompatible with your drugs, and that excipient and components that should not interfere with the release mechanism, as well as that should not affect the therapeutic efficacy of the drugs. So, based on that, we need to select the right components, and we need to perform the compatibility studies with the drugs, and then based on that, by perform pre-formulation studies, we can select the right ingredients or right materials, right components to make the right targeted or transdermal delivery systems. So, the formulation components affects the absorption significantly. It has a positive effect as well as there are the negative effects also possible with the components. So, it influences the rate of drug release as well as permeability of the stratum corneum. The best example is the permeation enhancers. Also, here we use some hydrations and the lipids that will help to improve the skin permeability. Even though if a drug has the low permeability, but when you convert into the lipophilic formulation or lipid based drug delivery systems by using of such permeation enhancers and lipids, so you can enhance the permeability. That it has a great demand for the various types of the water soluble or hydrophilic molecules when you convert into the lipophilic formulations. Now, here the another point we are going to see on the use of the permeation enhancers. Now, as we discussed in our previous slides also, permeation enhancers will help the drug to pass through the skin more easily. Now, we know that skin has various barriers. As we discussed in our previous session, the skin has a dead cells on the outermost layer which is called as stratum corneum, and which will not allow, which will not pass the hydrophilic molecules, and even though if pass it, it will show, it will release the very few amount of the drug into the systemic circulation. So, to enhance the permeation of such drugs, we need to use permeation enhancers, and they work by improving the sorption or using the permeation promoters. So, here you can see the mechanism which is provided here. So, these agents or chemical agents are the molecules which will alter the lipid structure of the stratum corneum. So, now you can see here, so they will interact with the lipid membrane and they will change the structure or the arrangement of lipids because of these are the chemical agents. Okay. So, here you can see the lipid alteration, also they change the protein modification of the stratum corneum, and they also increase the drug solubility by using of the permeation enhancers within the stratum corneum. So, here you can see the first one interacting with the aqueous domain and then interacting with the lipid domain and opening the tight junctions. So, these are also possible, and also the fluidizing membrane. So, by these mechanisms, so permeation enhancers will work as an efficient components in the novel drug delivery systems. So, these are the examples like sulfoxide, azones, ketones, fatty acids and the fatty esters. We are going to discuss very detail in our upcoming slides, upcoming presentations in the components of the transdermal patches. So, the third factor is that biological factors of the skin. So, here we know that in the skin the outer layer is the stratum corneum, and in again there we studied the stratum corneum has a 15 to 20 layers, right. So, in that the topmost layer is called as horny layer, that is the outer layer of the stratum corneum. So, it has a property that after administration the drug molecules or your formulation will retain, or it works as a depot and it works as a reservoir systems. So, this will help for the controlled release of your formulation. So, you can read here, the outer skin layer can store the drug temporarily, acting as a reservoir or depot. So, that is good for the control release. It will increase in the retention time of the formulation at the site of administration. So, site of application also matters as we are discussing on the physiology and the biological factors. So, thinner skin layers absorb drugs better than the thicker ones. For example, here it is a very thin type of the layers. So, the chances of the permeation will be very high. If you have more number of layers in the skin and the skin layers are very thick, then permeation is very critical. Each layer will be rate limiting step for the permeation. And the second is site of application affects how much drug is absorbed. So, the site of application also will, which is matters at the skin, and there are the skin which has in a dry state and some are in the hydration state and some are the exposed to the outside environment. So, this all will be considered as a factors will influence the transdermal permeation. So, duration of application, the longer contact time between the drug and skin leads to the greater absorption. So, here we need to use some of the formulation strategies or mucoadhesive strategies, so that we can enhance the contact time of the patch with the skin. So, your drug will enter and also it will interact with the skin. So, that leads to the greater absorption. And the second one is moisture retaining vehicles. So, here there are the vehicles that will increase the skin moisture, because that ultimately help for the absorption. If it is a dry skin and the wet skin, and when you compare these two, the moisture available at this skin is high and here is the very less. So, that moisture will help for the swelling, as well as it will also help to release the molecule, and also it will help for the, it will increases the contact time of the transdermal patch. So, there are the vehicles which will work as the moisture retaining properties. So, that will take that water from the skin as well, and that will remain contact with the skin. So, in such cases we need to, if there are the products are in the dry skin condition, we can use such moisture retaining vehicles that will help for the drug absorption. So, oleogenous vehicles which will act as a moisture barrier, when you apply you can also avoid the all type of the dryness and trapping, they will trap the sweat under the skin. So, these are need to be utilized or need to be added in the final formulation to avoid all type of the physiological conditions or physiological problems. These causes occlusions leading to the greater hydration of the skin beneath the vehicle. So, this is one of the strategy to overcome the all type of the dryness of the skin. And the third one is skin temperature, and here the when you are using the stimuli responsive formulations, so such cases temperature also has a major factor in the permeation. When the temperature increases from 10 degrees centigrade to 37 degrees centigrade, the drug absorption increases 10 times. When in the cold conditions or in the when you have a winter conditions, and when you change from the temperature from 37 to 10 degrees centigrade, definitely you will see the decrement of the drugs. And when you increase the temperature from 10 degrees centigrade to 37 degrees centigrade, and your absorption will increase the 10 times. So, this all we need to consider while developing the formulations. And the last one in the biological factors of the skin, that is skin hydration. So, hydration of the stratum corneum is a key factor that, as we discussed in the moisture providing vehicle or moisture retaining vehicle. So, this will increases the permeability, helping the substances pass through more easily. Hydration softens the tissues, and that will expand the pores and they create the sponging effect, allowing the both large and small molecules to flow better. Hydrating the stratum corneum can increase the skin permeability up to 8 times. So, we need to use the moisture retaining vehicles, and there are the cases we need to hydrate the skin before the administration. So, all these factors, if you related to the skin as well as the drug and as well as related to the drug delivery systems, will definitely influence the ultimate the absorption and the permeability of the drug through the skin. So, while designing the transdermal formulations, we need to consider the physicochemical properties of the drug, that we need to understand the each parameter of the drug as well as what type of dosage form will help for the maximum bioavailability. Based on the limitations of your drug, you need to create, you need to design such formulation. If your drug is lipophilic, if your drug is hydrophilic, and if you want to improve the permeability, you need to play with various types of lipid formulations as well as permeation enhancers, and there are other strategies which can improve the permeability. So, we need to convert into the effective dosage form, and ultimately we need to uh, achieve the effective concentration in the blood. So, with this we need to consider all these factors: physicochemical properties of the drug, physicochemical properties of delivery systems, as well as biological, nothing but the pathological and physiological conditions of the skin. With this, by understanding of this, we can create a novel advanced transdermal patches. So, with this, today I am going to stop the lecture at here, and in our upcoming classes we are going to discuss on the components used in the transdermal drug delivery systems. Thank you so much.